Next, we have Dr. James Liu, CEO and co-founder of Helix. Helix is a leading population genomics company. And as part of the pandemic response, Helix partnered with NIH to stand up one of the largest diagnostic testing labs in the country. And they also partnered with CDC to enable national genomic surveillance and forecasting. Dr. Liu?
Caitlin, thank you for having us, and thank you to the CFA for, I mean, it's just a wonderful thing that this is getting set up today. As Caitlin mentioned, Helix is a leading population genomics company. As part of our pandemic response, we set up the largest West Coast diagnostic capability in partnership with the RADx program at NIH. And then we did some of the early work in setting up variant surveillance, genomic surveillance with the CDC, I guess in December of 2020 at this time. So it seems like a lifetime ago, pandemic time, but certainly only about 15 months ago. We're big believers in forecasting. Just at the very basic local level for us, the ability to leverage genomic variant data and use that to forecast our ability in the supply chain to manage diagnostic testing was essential for us to think about managing for the Delta surge as well as the Omicron surge, and essentially forward buying that supply chain so that we can continue to service during those periods. But even within our health system partnerships that we do day to day, we started reporting out analytics that we generate in partnership with CDC to help them manage the healthcare systems. And for many of those partners on the healthcare side, provider side, it's about how you manage your labor force and workforce at a time with incredible stress. It's about managing your capital and your logistics as well. And so we've been very intimately involved in some of those efforts as well. And we are incredibly excited about the CFA's formation and the ability to leverage this data on a more global scale. I would say a couple of quick lessons from having really been in the trenches, as we've done a lot of public health reporting to all 50 states, both on the diagnostic side and on the variant side, as well as establishing quite a few public-private partnerships throughout the pandemic. And I would say, I just reiterate Dr. Walensky's comments around data modernization. I mean, 50 states, 50 systems, thousands of jurisdictions, each wanting individual reporting is unscalable for any organization. And so standardized endpoints and standardized architecture and data formatting is going to be essential. And one of the things that we saw, even with one of our local health systems, was that for them to get the analytics back on what was circulating in their region took 60 days from the public health reporting. In a fast-moving pandemic, 60 days is a lifetime. And so even the ability to return data back, very simply, like what is happening in your local region, because this is very much a regional pandemic, or was a regional pandemic, was essential for their operations. The second piece that we've found to be incredibly important has been data linkage and data around data sharing. And it has been important to understand what's circulating, but I think as the CFA's work with Kaiser has certainly shown, is that linkage to clinical data on the clinical severity is essential in terms of understanding the true impact, both to the economy, but also to the local healthcare providers. And so we've been doing a lot of work on that as well, and really focused particularly in populations which have been undersampled. And we're doing that work now with the Rockefeller, focused on some of these populations that have been both underserved as well as been most disproportionately impacted by the pandemic. And lastly, we do believe that the private industry has a real role to play here in terms of partnership, and both in access to scale technologies and being able to perform and access partnerships that maybe not be available to some of the public sector. And so we're really excited about our experience with working with government. We think we can really be a force multiplier, and we're excited to continue to explore those